Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of To Take Your Life Back Today's show. As an addiction recovery coach, I want to share something with you, and let me be crystal clear to leave an everlasting impact upon you. Just imagine being buried alive. You're in the coffin, but you know you're not dead. You don't know how to get out of the coffin. You tried lifting the lid, but the enormous weight of the lid prevents you from opening it. You just then start banging on the lid, but you're thinking, maybe if I bang hard enough, I can unsettle the dirt and people on top might start digging their way down towards me. This is what it's like to find yourself at the lowest point of alcohol and drug addiction. You know you need help. You know you can't do it on your own, but you don't know where to turn. In reality, there are people probably standing right by your grave. You just don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, my audience, did it ever cross your mind while you were using drugs and alcohol that maybe, just maybe, you might overdose and take something away that God gave you called life? And if that's not selfish enough, you'll take it away from the people that love and care for you most. People like your mother, your father, husband or wife, brother or sister, children or even grandchildren. With this, let me leave one last thought. Don't be like the person that I read about on this index, or these index cards, that went to their grave without seeking help. Instead, give me a call at 844-405-HELP, and I promise you I will help you take your life back, for your life is gone. People like Larry Geis from the Geis Academy, an addiction recovery coach, life coach for over 30 years, at 516-458-2741 or www.odysseyconsultant.org. Larry Geis and I always tell folks like you, it doesn't matter where you've been, it doesn't matter where you came from. What matters most is that you're here for a better today and a brighter tomorrow. Larry Geis will take you from your depression to happier times, low self-esteem to raising your self-esteem, from your addiction to recovery. But you need to give him a call at 516-458-2741. Larry Geis from the Geis Academy. Folks, don't forget, when you go to bed at night, take your slippers off, but don't put them at the edge of your bed. Put them under your bed. And when you put them under your bed, in the morning, you'll be forced, when you get up, to jump off your bed and look under your bed to retrieve them. And while you're looking under the bed, you'll be on your knees, and while you're on your knees, praise God for another beautiful day to enjoy that stream and that waterfall. Praise God for having a home and clothing and food and a relationship and your health. Ask God for guidance and direction. Ask God for mercy and forgiveness. When you're done speaking to God, put on your slippers. Stand straight up, roll your shoulders back, stick your chest out, and walk with God 24/7. Repeat this pattern day after day, 24/7. Take the slippers off, stick them under your bed at night. In the morning, get on your knees, retrieve those slippers, and praise God. I want to talk about alternatives to nursing homes, because let me tell you something, folks. We're all going to be there one day, and one thing that I fear most is just being left somewhere where I don't want to be. So let's talk about alternatives for nursing home. Before you make any decisions about long-term care, get as much information as you can about where you might live and what help you may need. A nursing home may not be your only choice. Discharge planners and social workers in hospitals, nursing homes, and home health agencies can explain your options to help arrange your care. Find agencies in your state, community, and that can help you in the long-term care choices. If you have limited income and resources, there may be state programs that will cover some of your costs in some of of these long-term care choice mentioned. Call your state medical assistance office. Opens in a new window of opportunities when you call there. Community service. They are a variety of community services that might help you with your personal care and activities. Some services, like volunteer groups that help with things like shopping or transportation, may be low cost, or the group may ask for voluntary donation. Some services may be available at a varied cost, depending on where you live and the services you need. We will discuss a list of home services and programs that can be found in many communities to follow. You have adult daycare, meal programs like Meals on Wheels, senior centers, friendly visitor programs, help with shopping and transportation, help with legal questions, bill paying, or other financial matters. Home care. Depending on your needs, you may be able to get help with your personal activities, like laundry, shopping, cooking, and cleaning. at home from family members, friends, or even volunteer groups. If you think you need home care, talk to your family to see how they can help you and find care or help arrange for other care providers. There are also some healthcare agencies that can help with nursing or attending care in your home, which is good news. Medicare only pays for home care if you meet certain conditions. To learn more, go to www.medicare.org and look under Home Health Care. To get a free copy, just visit Medicare Publications at www.medicare.org, or you can call 1-800-MEDICARE. That's 1-800-633-4227. Accessory dwelling units, otherwise known as ADUs. If you or loved one owns a single-family home, adding an accessory dwelling unit to an existing home may help you keep your independence. An ADU, sometimes called an in-law apartment, an accessory apartment, or a second unit, is a second living space within your own home or on a lot. It is a separate living and sleeping area, a place to cook, and a place to go use the bathroom. Space like an upper floor, basement, attic, or space over a garage may be turned into an ADU. Family members might be interested in living in an ADU in your home, or you may want to build separate living space at your family member's home. Check with your local zoning office to be sure ADUs are allowed in your area, and if there are special rules, make sure that you pay attention to them. The cost for an ADU can vary widely depending on how big it is, how much it costs for building materials, and the workers. Subsidized senior housing. There are federal and state programs that help pay for housing for some older people with low to moderate incomes. Some of those housing programs also offer help with meals and other activities like housekeeping, shopping, and doing laundry. Residents usually live in their own apartments in these complexes. Rent payments are usually a percentage of your income, a sliding scale. Board and care homes. Board and care homes are group living arrangements designed to meet the needs of people who can't live independently but don't need nursing home services. Most board and care homes provide help with some of the activities to daily living like bathing, dressing, and using the bathroom. Board and care homes are sometimes called group homes. Many of these homes aren't paid by Medicare or Medicaid. The monthly charge is usually a percentage of your income, like the sliding scale we discussed before, that covers the cost of rent, meals, and other basic shared services. Assisted living facilities. These facilities provide help with activities, daily living, like bathing, dressing, and using the bathroom. They may also help with the care most people do themselves, like taking medicine or using eye drops, and additional services like getting to appointments and preparing meals. Residents often live on their own and have their own room or apartment within a building or a group of buildings, and have some or all of their meals together. Social and recreational activities are usually provided. Some of these facilities have health services on site. In most cases, assisted living residents pay a regular monthly rental fee and then pay additional fees for services they get. The term assisted living may mean different things in different facilities. Not all assisted living facilities provide the same services. It is very important that you contact the facility and make sure that they can meet your particular needs. Continuing Care Retirement Communities, otherwise known as CCRCs. CCRCs are retirement communities that offer more than one kind of housing and different levels of care. In the same community, there may be individual homes or apartments for residents who live on their own, an assisted living facility for people who need help with daily care, and a nursing home for those who require more care. Residents move from one level to another based on their needs, but usually stay within the CCRC. If you're considering a CCRC, be sure to check the nursing home at the CCRC. The nursing home's quality information is on the Nursing Home Compare and Nursing Homes Inspection Report, should be posted in the nursing home. Your CCRC contract usually requires you to use the CCRC's nursing home if you need nursing home care. Some CCRCs will only admit people into their nursing home if they have previously lived in another section of the retirement community, like their assisted living or independent area. Many CCRCs generally require a large payment before you move in, called an entry fee, and charge monthly fees thereafter. Find out if the CCRC is accredited and get advice on selecting the type of community from the Commission on Accreditation of Rehabilitation Facilities in the Continual Care Accreditation Commission. Opens in at just about any community, but you can also call area code 202-587-5001 for a main number. And then, of course, we have hospice care. Hospice is a special way of caring for people who are terminally ill with 6 months or less to live, and for their families. Hospice care includes physical care and counseling. The goal of a hospice is to provide comfort for the terminally ill patients and their families, not to cure their illnesses. If you qualify for hospice care, you can get medical and support services, including nursing care, medical social services, doctor services, counseling, homemaker services, and other types of services. As part of the hospice care, you will have a team of doctors, nurses, home health aides, social workers, counselors, and trained volunteers to help you and your family cope with your illness. Depending on your condition, you may get hospice care in a hospice facility, hospital, or nursing home. Respite care. Some nursing homes and hospice care facilities may provide respite care. Respite care is a very short inpatient stay given to hospice patients so that the usual caregiver can rest. Medicare covers respite care for up to 5 days if you're getting covered hospice care. Room and board are covered for the inpatient respite care and during short-term hospital stays. Get more information about Medicare coverage of hospice care and who qualifies by going to www.medicare.org. And you can also call 1-800-MEDICARE. That's 1-800-MEDICARE. Program for All-Inclusive Care for Elderly, otherwise known as PACE. PACE manages of all medical, social, and long-term care services for frail people to remain in their homes and to maintain their quality of life. PACE is available only in states that have chosen to offer if under Medicaid. The goal of PACE is to help people stay independent of living in their community as long as possible while getting the high-quality care they need. To be eligible for PACE, you must be 55 or older, live in the service area of PACE program, be certified as eligible for nursing home care by appropriate state agencies, and be able to live safely within that community. To find out if there's a PACE program, you can call your state medical assistance office. Home and community-based waiver programs. If you're already eligible for Medicaid, or in some states would be eligible for Medicaid coverage in a nursing home, you may be able to get help with the cost of some home and community-based services like homemaker services, personal care, and respite care. States have home and community-based waiver programs to help people keep their independence while getting the care they need outside of the inpatient facility. It is an alternative. These are alternatives to nursing homes. So folks, if you're watching me and you happen to be an elder, possibly looking into a nursing home, or if you're a family member who has somebody looking into nursing home, please discuss this. Review this videotape. Remember, folks, I keep hard copies of everything I read because I do read it quick. I only have limited time on these videos. So if you want a hard copy, just give me a call at 844-405-HELP or text me at 631-599-0218 631-599-0218 for my text. And together, you and I can make sure that the elders or anyone else gets the proper care they need, and may God bless you.